Her career in country music couldn't combat the personal demons Naomi Judd was struggling with. The 76-year-old superstar died by suicide on April 30th after what her family described as a long battle with mental illness. 2 days later, another name that had grabbed headlines, 16-year-old Kylie Posey of Toddlers and Tiaras fame, died by suicide, according to her family, in her car at Burge Bay State Park in Washington. She'd won countless pageant crowns and trophies, had a professional touring job as a contortionist, and had been chosen to join her high school's cheerleading team in the fall. May is Mental Health Awareness Month, and I'm now live with Dr. Andrew Mendonza and Jane Ann Zakari from Sacramento County Behavioral Health to talk about the local resources available for those facing the kind of challenges that Naomi Judd and Kylie Posey did. Welcome to you both to Fox 40 News at 11.
Thank you.
Thank you.
What are the numbers like in Sacramento County? How many people are making this devastating choice to end their own lives?
In Sacramento County, we do have some statistics fairly recent. Unfortunately, suicide data is oftentimes a year or so behind, but right now we're about 181 suicides in Sacramento County. We are seeing a little bit of an uptick in suicides related to males, older adults over the age of 85, and folks who are white and Native American.
Okay, and specifically when it comes to adolescents, the Centers for Disease Control and Prevention report the number of teen girls who've been suicidal has increased 50% nationwide since 2019. Pandemic isolation having a lot to do with that. Do those numbers track the same in Sac County?
Unfortunately, we are seeing a little bit of an uptick with our suicide and our self-harm within our adolescent population. You know, really what we know about this population is youth. They don't really have that reference point, right, that a lot of us have as adults. We've been through rough stuff as adults. We know things get better with time. Unfortunately, a lot of the youth don't have that reference point, and so unfortunately, they choose suicide or they choose self-harm. So we are actually seeing a little bit of an uptick under the age of 18. We did see an increase between the ages of 10 and 24 among female youth who are Black, and youth who are Hispanic.
Alrighty, now when it comes to available resources, national estimates place the average wait time for a therapist appointment when someone realizes that they may need help at 48 days. That's the average. For children, it can be even longer. So desperate folks are turning to the ER, and that maybe isn't the best place for them to be going. What resources can people turn to in the county if they need immediate help?
We have really uplifted our suicide prevention resources, recognizing the tremendous need for our community. And so we support the Suicide Crisis Line, which is one of the national suicide prevention lifelines. They offer suicide crisis chat as well by text, and are available 24/7 by phone. And crisis chat by text is available at key times during the day and evening, and is really been shown to be a wonderful resource for our young people who might be more comfortable chatting via text. We also have our mental health urgent care clinic, which provides services on a walk-in basis for all ages who are experiencing any kind of a mental health or co-occurring crisis. And we do ask that you call before to confirm hours and availability. And then this summer, we will be launching a wellness crisis call center and response team, which, as you can tell by the title, will offer a call-in center for crisis, but also have response capability to go out into the community. We also have a number of ethnic and cultural community resources that are in our suicide prevention programming network and can be accessed through our behavioral health website as well. So we've really tried to boost these services, recognizing the tremendous crisis and need in the community.
And if somebody's trying to plug into the resources that you just mentioned, especially the urgent care, what do they do? What's the endpoint with the county?
I can provide telephone numbers right now if that would be helpful.
Yeah.
So the suicide crisis line can be reached at 1-800-273-8255. Our mental health urgent care clinic is located on Stockton Boulevard and can be reached at telephone number 916-520-2460.
Alrighty, and we're going to have those numbers later on today on our website. Now, for either of you, if you're dealing with a loved one who you maybe feel is slipping into despair and considering harming themselves, what's the number one bit of advice you want to have for someone who maybe is close to someone who is in this kind of crisis? Because a lot of loved ones feel sort of at a loss. We want to tell somebody that it's going to get better, and that's not really the most helpful thing for that other person.
One area that we've made a lot of headway in and been working for a number of years is in working to reduce the stigma and discrimination that's associated with mental illness. And so we launched many years ago a project called Mental Illness. It's Not Always What You Think. And it really works to reduce the stigma and the perceptions around mental illness, working really to normalize needing help, having a hard time. And so we have a website with a number of resources, and it is stopstigmasacramento.org. And there are tip cards, suggestions on how to get the conversation started, many resources for individuals who are experiencing a difficult time, as well as resources for loved ones who want to support someone in having a difficult time or needing to reach out for services.
And just now, if somebody is listening, somebody who has had suicidal thoughts themselves, who may be feeling like it might be better if they're not around, what do you want to say to them about it actually being an act of courage and not weakness to come forward and ask for help?
It is absolutely an act of courage. Right now, it is now more than ever acceptable and really, looked upon as something really heroic to come forward, tell your story, seek out help. Really, so many people can learn from you. So many folks can learn that are going through the same thing you're going through. So really looking at it as this is a chance for me to heal and get the help that I need, but also you may help hundreds, if not thousands of people by telling your story and getting yourself help. You can go out and help others in return.
And you all may have just helped thousands of people by coming on this morning to share what's available just right here in Sacramento County. We're going to get some of those numbers onto our website attached to this interview. Thank you so much for joining us this morning.
Thank you.
Thank you again. And
just again, if for immediate help, if you're considering suicide, you can call the National Suicide Prevention Lifeline at 1-800-273-8255. You heard that number a little bit earlier. And if you or someone you know is struggling with the death by suicide of a loved one, you can find help locally through Friends for Survival by dialing 916-392-0664. That is a warm line that connects you to help after someone you know has taken their own life.